All right, good evening, everybody. Good morning to those of you who are in America and Europe. Welcome to this webinar on recent advances in the treatment of autism and cerebral palsy. I'm Dr. Alok Sharma. I'm a neurosurgeon with a special interest in regenerative medicine and treatment for various incurable neurological conditions. Uh, All right, so why are we all here? We are all here because we have children who have special needs, and we have been from pillar to post, we've gone everywhere, and we've been told that except for rehabilitation, there's not much that can be done for our children. And as parents, we live on hope. We live in faith that something will soon be available that will help our children get back into normal mainstream life. And I'm here to share with you some of the medical advances that will actually make this happen. So our treatments, I'm going to talk about three sets of treatments: cellular therapy using stem cells, a comprehensive rehabilitation plan, and certain integrative therapies that are basically oxygen-based therapies. So, if you see the X-ray on the left, you can see that's the X-ray of a bone which is broken. You can see the bone that is broken. Both the bones are broken. And I ask you that if we had a fracture like this, would we do physiotherapy or rehabilitation on a broken bone like this? We would not, right? What we would do is we would go to an orthopedic surgeon, we would get it fixed, we would have plates and screws, and then we would give rehabilitation on this. But for our special needs children, we are doing exactly the opposite. Here is a PET CT scan of the brain where the blue is damaged brain. This is a scan of a child with autism. You can see the blue is damaged, and we are giving rehabilitation on this damaged brain. We are giving occupational therapy and speech therapy and psychological and behavioral therapy on a damaged brain. Obviously, we will not get the results that we want. Now, what if we could repair the brain? The green is brain that's repaired. And what if we gave rehabilitation on this repaired brain? Would or would we not get better results? So I'm here to let you know that it is possible today through very simple, safe, and effective methods to repair the brain damage in our children with autism and cerebral palsy, and then be able to give them that opportunity where the rehabilitation gives us better results and faster results. So the old thinking was that once the nervous system is damaged, nothing can be done. You cannot repair the central nervous system. But the new thinking is that you can repair the central nervous system, the brain, with cellular replacement and repair. So we will now look at the treatment that you all want to hear about, which is stem cell therapy. So stem cell therapy is something which has shifted us from a state of hopelessness. 20 years ago when I started working in this field, we were in a state of hopelessness. There's nothing that we could do. But everything has changed in the last 20 years. And today we have hope. So what exactly are stem cells? The word stem comes from the stem, a seed, it gives rise to a stem. And from the stem, the plant or the tree is formed, and from here you have the branches, flowers, and fruits. So it is from the stem that everything else comes. Likewise, there are some cells from which the rest of the body can be made. There are cells which can become brain, muscle, heart, liver. These cells from which the whole body can be made, these cells which can become any part of the body, these cells are called stem cells. So how do they work? The first ability of stem cells is they multiply. So if you have a single stem cell, you can make thousands, lakhs, or even millions of stem cells from a single stem cell. Second, and this is the most useful property, they convert into other cell types. So if you have a single stem cell, I can use this to make it into a brain cell, or a heart cell, or a muscle cell, or a blood cell, or anything that I want. So this cell can be converted into whatever we want depending on where we place it. So that's the beauty and magic of stem cells. You can convert a stem cell into what you want, and then you can make it multiply. They also, and this is a picture from our own research. This is not an internet picture. This is my own research 15 years ago, where we grew the stem cells outside in the laboratory, and we showed that the stem cells can convert. These are brain cells. We showed that they convert into brain cells. So we now know that a stem cell can convert into a brain cell. They also release certain positive chemicals in the body, and they are called growth factors, and they improve the blood supply. You can see the stem cells are there. If the blood supply is less, they attract more blood vessels towards it. So stem cells are of two types. There is autologous, that means when you take from the patient, from the child, and put it back into the same child. That is called autologous. And allogenic is when you take from the outside and you take from somewhere else, somebody else's cells, and put it in your child. There are different types of stem cells. You can get stem cells from the embryo. So life starts when the father's sperm and mother's egg comes together and becomes a fertilized egg. This then divides. 1 becomes 2, 2 becomes 4, 4 becomes 8. And at 5 days in our mother's womb, we are a grape-like bundle of cells. These are all stem cells. In other words, on our 5th day of life in our mother's womb, all of us were a collection of stem cells. And from that stem cells, the whole body was formed, which means that stem cells have the ability to form all tissues of the body. But embryonic stem cells are dangerous. They, it's not safe to use them. They have side effects, and there are many ethical issues. So we do not use embryonic stem cells. I repeat, we do not use embryonic stem cells. Then you can get stem cells from the umbilical cord. So the umbilical cord is the cord that connects the mother and baby at birth. Normally this is thrown away in the garbage, but nowadays at birth they are preserving these. And if it has been preserved, then you can use, because this umbilical cord is very rich in stem cells. So you can extract the stem cells from there, you can use it. Then we have, adult stem cells, or this is what we use. These are stem cells in our own body. And the area where you find the maximum are in the bone. So in the center of our bone is a liquid called bone marrow, which is rich with stem cells. So, we can actually get stem cells from our own body. And the last type, induced pluripotent stem cell, this is a combination of outside stem cells, inside embryonic, but this is in a research stage. So, is about adult stem cells. So we choose to work with adult stem cells, 1, because they're completely safe. 2, they don't form tumors, they don't get rejected because they are your own cells. You can easily get them through a single needle, aspiration. And there are no ethical issues about the use of adult stem cells. Now, how do we inject the stem cells? You can inject it into the fluid in the lower spine like this, and then the fluid takes it to the brain. This is our preferred method. You can also inject it intravenously, intramuscularly, intraarterially. You can give it through the nose. You can put it directly in the brain. There are many ways of doing it, but we prefer this particular method. So basically, what is stem cell therapy? We are using healthy cells, good cells, to replace damaged cells. That's all we are doing. So here you have, you can see the damage. The blue is the damage in the brain. You give stem cells, and the damage goes away. So what's the scientific base for stem cells? You all know that the highest recognition in medicine is a prize called the Nobel Prize. And 3 times in a 15-year period between 1990 and 2012, 1990, 2007, 2012, the Nobel Prize went to stem cell research. The work that we do, stem cells in bone marrow, this got the Nobel Prize in 1990. So, this explains the scientific base of our work. And what's the basis of the work that we do? So we have a total of over 100 scientific papers. We have 16 papers on autism, 15 in cerebral palsy, 18 in muscular dystrophy. So what is the meaning of this? See, when we do work and we publish it, when it goes to a journal, the journal's editor, editorial board, and 3 independent reviewers, they review that data. They verify scientific content, its ethical base, and only then they allow its publication. So, when our work is published, it has been peer reviewed. Peer reviewed means somebody outside of us has seen the data and validated that and said, yes, this is authentic. So we don't have one or two papers, we have over 100 papers. Okay. All our results are in the public domain and they've been peer reviewed, they've been verified by somebody else and authenticated. So this is a very important part. Whenever there is a new treatment and you go to any doctor, any hospital, you must ask this question: are your results published in medical journals? Apart from medical journals, our work is published in textbooks. So this is a medical book, Recent Advances in Autism, and they introduced a chapter, Stem Cell Therapy in Autism. And when they had to decide who will write this chapter, they invited us. So we wrote this chapter on stem cell therapy in this medical book on autism, in this book on cerebral palsy by Intech. Again, there's a chapter, Stem Cell Therapy for Cerebral Palsy. Again, they invited us to write this chapter. In this book on physical disabilities, Stem Cell Therapy in Pediatric Neurological Disorders, again written by us. In this book on muscular dystrophy as a therapeutic modality by Avid Science. These are all medical books. And the chapters on stem cell therapy, so there are two parts here. Medical books are introducing chapters on stem cell therapy in autism, cerebral palsy. Okay. And when they have to decide who will write that chapter, these are international textbooks. They're authors from all over the world. They select us because we have the largest volume of data. So we have published chapters in textbooks as well. Now, the government of India at the highest level is very supportive of stem cells. The Honorable Prime Minister, Sri Narendra Modi, when he went to Japan, he actually visited the Stem Cell Therapy Center of Professor Yamanaka, who won the Nobel Prize in Medicine. In Bangalore also, he's visited the Institute for Stem Cell Research. I'm very fortunate that in a book that I have written, the Honorable Prime Minister has written an introduction. So it is a matter of honor, and this is me presenting that book to him. This is the introduction that he's written. You can see his signature, his letterhead. So he's written this, and he is somebody who does believe in stem cells. And I'll just share with you a small video where in the Indian Parliament he gave a small speech on stem cell therapy.
मैं जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहाँ एक नोबेल लॉरिएट साइंटिस्ट या वहाँ को मिल गया, मैं इसलिए किया गया, उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है। हम गए तो वहाँ गए, उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
So here is the Prime Minister of India talking in the Indian Parliament about stem cells. So that's very, very important. Now, let's look at how this treatment is done, how we do this treatment. So the beauty of this treatment is the sheer simplicity. What we do is we take a needle, we put it into the bone just above the hip bone, the pelvic. See, this is the hip. Above that is the pelvic bone, and we put a needle here. This is a real picture. We'll be seeing a video of that. And we just, with the syringe, pull out the bone marrow. This bone marrow is taken to the laboratory, where it is sort of filtered, separated by a method called the density gradient method. And then once the stem cells are separated with a very thin needle, we inject it into the lower lumbar spine and into the spine fluid, and the fluid takes it to the brain. So let's see a video of that. Here you can see, that's the bone marrow. There's the needle, that's the bone marrow coming out. We take it to the laboratory, we separate it. And then with a very thin needle, we inject it into the lumbar spine. So I'd just like to see this video again because it's an important video. You can see here. Here's the child sleeping. There's a needle. That's the bone marrow coming out. It's taken to the laboratory, separated, and with a very thin needle. You can see it's a very thin needle. We inject it into the fluid in the lower spine. So the whole treatment has got only 2 needle pricks. With one we take out, with one we put in. And what are we putting in? We are putting in cells from the child itself. So there's nothing from the outside. There's no danger. There's no risk whatsoever. That's again a still picture, bone marrow aspiration, stem cell separation, and stem cell injection. So let's look at autism. It was, autism was sort of described fairly recently as, 1943, unlike all other illnesses which have been there for much before. Typically, it occurs in the first 3 years of life. We diagnose it. Now it's referred to as a spectrum disorder, which is either mild, moderate, or severe. Boys have it 4 times more than girls. Now, the thing about autism is that it is increasing crazily. So, 2004, 1 out of 166 children had autism. And 2020, it's gone up to 1 in 54. That's a 3-time increase. And every year, every single year, the incidence of autism is just going up and up and up. And we just can't figure out why that is so. 20, 25 years ago, when we started, when we were medical school, autism hardly existed. And now it is so rampant, it is so common that it's becoming literally something that happens in so many households. So there are 70 million people with autism on the planet, which, by the way, is 1% of the world's population. So, most people don't realize that 1% of the world, and that's not a small amount, has autism. Now, the symptoms in autism are a problem with communication, poor social interaction, and repetitive behavior. Now, what is new? So what's new about this webinar? What are you going to learn that's new? All this you knew already. First, we have a better understanding of autism. Up to now, doctor just made a diagnosis and said nothing can be done, take rehabilitation. That's old thinking. I wish the rest of the world would wake up. We now have a better understanding of what is going on in the brains of our children, and we need to do something about it. And what else is new is that we have a new treatment, which is referred to as stem cell therapy. So this is what is new. This is a scan of the brain called a PET CT scan. And this shows the blue area is the area of damage. So we have done this in 3,500 children with autism and almost 3,000 children with cerebral palsy. And all the children, every single one, has a damage like, the autism children have a similar kind of damage. So for the very first time now in medical history, we know why our child cannot speak, why our child has behavioral issues, why our child has repetitive issues. We understand because there are parts of the brain which are not working properly. And we have published this in a very prestigious journal, the World Journal of Nuclear Medicine, where we've actually shown what's happening in the brains of these children. So you'll be surprised, most times doctors don't even evaluate what's going on in the brain. Just make a diagnosis, just let the kids be. But we need to know what's going on in the brain. And we today have technology to do that. And then the management of autism. Now, one thing I wanted to get, the management of autism is multidisciplinary. There is no silver bullet. People think stem cell therapy is a silver bullet. You give stem cells, my child will become normal. No. Stem cell is a very important part because it repairs the brain. However, rehabilitation is also very important. And all the rehabilitation, occupational therapy, behavioral therapy, speech therapy, all of them. There are many other treatments also, things like diet and, some people try biomedical and hyperbaric oxygen, chelation and neurofeedback. So all of these things play an important role. So we must get that the treatment is comprehensive. So I gave you a little brief about stem cells. Now I'm going to tell you a little bit about rehab. You already know this, so we're going to run through this fast. There are different, there's applied behavioral analysis, which basically, because that every behavior has something that antecedes it and there's a consequence. And by modulating that, you can modulate behavior. That's our ABA session at our institute. There is occupational therapy. You all know what it is, but occupational therapy has got so many components, from activities of daily living to cognitive behavioral therapy to recreational and vocational. Then there's sensory, this is occupational therapy. Then there's sensory integration, which is a subsection of occupational therapy, but it's very much needed because most of these kids have sensory issues, and that requires a separate room. This is our sensory integration room. Speech therapy is very important, and the old thinking was you need, motor speech, and now the focus is on communication rather than motor speech. and that's like our speech therapy unit. Then physiotherapy. Now, this is something most people don't realize. Most people think that autism kids don't need physiotherapy. But what we found is that we are so focused on their speech and their behavior, we don't focus on their physicality. But they have problems, which is motor coordination, clumsiness in their movements, tone, gait, postural stability, etc. So they need physiotherapy as well. Physiotherapy is a very important role to play in children with autism. Aquatic therapy, we are finding it to be extremely useful. It helps in so many issues, from reducing the sensory issues to improving the sleep pattern, reducing hyperactivity, etc. So we recommend aquatic therapy to everyone, and that's our aquatic therapy at our institute. Then there are art-based therapies which are also beneficial. There you can see music therapy. Then there are other treatments like removal of heavy metals, chelation, TRS detox. There are supplements which all of you I'm sure have used: vitamin B6, vitamin C, omega-3, DMG, prebiotics, and several other supplements which I'm sure everybody has used, which are good and useful, and you can continue them. There is nothing to stop using these after stem cell therapy. But these supplements help in overall health. They don't repair the damage in the brain. That blue stuff I showed you, before, that doesn't get fixed with stem cells. But all these things are helpful, and diet and nutrition. What we should eat is probiotics, prebiotics, ketogenic, gluten-free, casein-free diet, camel milk, etc. These are very useful. Anything with sugars, additives, and pesticides is not so good. A ketogenic diet, which is high fat, enough protein, and low carbs, is also very useful. But are we doing enough? We are doing all of this, but we need to do something more, and that's where the role of stem cell therapy comes. And what we have found is that in our children, now this is all the way back 3,500, this data from 700, 33% of our kids have a significant improvement. And now these are, of course, all kids who are younger. This is kids before puberty. 29% have a moderate improvement. That means they become independent but are not normal. Significant means they become neurotypical. %33% of the patients treated with stem cell therapy, especially those below puberty, go off the spectrum. 25% have mild improvement, 10% don't improve. And what we found is there's a direct age correlation. All the low improvements were it's over 20 years of age. The mild and moderate were between 10 and 20. The significant were below 10. So this means the earlier we treat our children, the better it is. The earlier we treat, our children are going to be here. The later we treat, our children are going to be down there. Now, on what basis? I'm making a claim. I'm saying that stem cell can reverse autism. For that, I need to have statistically significant results and objective improvements on brain imaging. So this is a calculation we do called statistics. So we take the average, like there's a score, the CGI score, the ISA score. We take an average of all the patients. We take all the patients average out before the stem cell. And then we take after the stem cell average. And what you can see is there is a significant difference. Same thing on the ISA scale, the Indian scale for autism, statistically different. Here again, social, emotional, speech, behavior. You can see everything is statistics. This is a mathematical calculation. Also on scans, these are PET CT scans. Above you can see before the stem cell, the blue is the damage. In the same child, you are seeing it at different views. And below, you can see that the blue has almost disappeared. See this huge blue damage. After stem cells, you don't see it anymore. You see all this extensive damage. After stem cells, you don't see it anymore. So this is objective proof, my friends, that the brain damage in children with autism can be reversed. And I'm just showing you 2 or 3 scans. We have over 3,000 scans, 3,500 to be precise. And again, you can see the damage before, and you can see it's gone. You can see the damage before, and you can see that it's gone. You can see this damage before, above is before, and below is afterwards. There's no damage. And some people asked us, when you do the scan at 6 months, how do you know this improvement sustained? So in a few children, we did it year after year. After one year, you can see the damage. It is reduced and it is still reduced. So what we have shown is that the improvement is progressive, it's sustained, it's persistent. You don't have a reversal in the improvement. The world's first scientific paper on stem cell therapy in autism was published by us. It was the world's first scientific paper. Autism was bone marrow mononuclear cells that open label proof of concept. And the second paper came from China, the third from Italy, and the fourth and fifth paper have come from the Duke University in America. We have a total of 16 scientific papers, and we've treated patients from 5 different continents. I mean, all the continents we have treated, and I'll just share with you maybe a couple of short videos of 1 or 2. So this is a child from America, a child with autism from America, and you can see the amazing transformation in this child.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just flew backwards.
Fly up like that. He would walk on his tiptoes, look at the wall, and be talking to the wall. He had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech, and research and found out about NeuroGen. The big question that I had now in mind was, what is there to do? And I could not come up with a good answer, and I said, we have to do it.
We started seeing better eye contact, definitely different in his engagement with us, with his siblings, his mood was so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out. But he'll wash himself and he'll put his clothes on. It's all the PET scan images. We were just so excited and thrilled. The areas that were hypoactive or non-active were more. There was activity there. Ganesh had gone from the 3rd grade, 4th month reading level to a 7th grade, 1st month reading level in 5 months.
So you can see a child that from being in a special school, he's going to a normal school. Not only going to a normal school, he's topping his class. He's getting A+ grades, right? His speech has come back. He's a normal child now, right? He's off the spectrum. So this is the magic of stem cells, and this is another set of
different hospitals.
children from Kenya. Let's see their story.
No. Don't worry, because they are boys, they are triplets, they are premature. I'll be walking out and I'm like, bye. No child is crying, no child is waving bye. And by then, for sure, I knew that they should be doing that. Children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes, he said, these children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what this means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came, actually, I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew the
We put a needle in the pelvic bone, and then we take out the bone marrow, which is the fluid inside the bone. The pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far.
They used to defecate on their clothes, but now they can use the toilets. We've seen a lot of improvements in in terms of spitting. The utterance have reduced. Sleeping used to be a problem before, but at the moment, he's taken to his bed, it takes a few minutes and he's asleep.
See my son's cycle. We try to make them understand what it is to have independence. After stem cell, when we arrived in Kenya the following day, and we went out, and these guys could cycle. I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what? In the shop. Where is the shop? Okay. So I'm going to give you 9. For what? Parents ask me, so you really think stem cell work? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell work, I'm doing until my children get well.
And one last video of this child from India.
Shantanu was my first child, so I was very excited about how he would be. But when I came to know that my child has a problem, it shocked me, and I wondered, why did this happen only to me?
Shantanu's behavior was very different from that of other normal children. For example, normal children walk on their feet, but Shantanu walked on his toes.
It has been 2 months since Shantanu's stem cell therapy. There have been many changes and many improvements. His hyperactivity has reduced drastically, and his attention span has improved a lot. He sits patiently in one place. He has started coordinating with his sister very well. He plays with her very affectionately. We are glad we took the decision to give him stem cell therapy. It has been 6 months since the stem cell therapy. Shantanu has shown a lot of improvements. His hyperactivity is almost as good as non-existent. His handwriting has become much better. His eye contact has also become better. I have never seen Shantanu dancing, but now he takes a keen interest in dancing. He also likes to listen to music. He can now fold clothes. Earlier, he was not able to fold even a handkerchief, but now he can easily fold blankets. He helps me in cutting vegetable and in cooking too. Goes to the market store for purchases. He passed his 10th grade. There have been improvements in many other aspects as well. For example, this emotional quotient has also increased. Now he hugs us very affectionately, calls me mother. Now he takes tuitions of other special kids.
So that was amazing. A special needs child had improved so much that he is now taking tuitions for other special needs kids. Okay, skip the other video. That we come to cerebral palsy. In cerebral palsy, there is damage to the brain, but the effects are seen more in the body. There is weakness, there is tightness in the limbs. There are different types of cerebral palsy. As you can see, the damage in cerebral palsy is much more severe. There are certain medicines you can take for convulsions, spasticity, etc. But the problem doesn't go away. There are certain surgical procedures, but this is also gives temporary relief. But when we use stem cells, you can see that 20% of our patients had a significant improvement. That means they become close to normal. 41% had a moderate improvement. That means they are independent, though they still have some symptoms. 30% had a mild and 9% didn't improve. And here's a scan. You can see before, that is the damage before, and on the right hand side, you can see the damage is completely cleared up. So this is objective proof that even the severe damage of cerebral palsy can be repaired. This is objective proof. This is a scan that is showing you. Here again, above you can see the damage on both sides, very extensive, and below you can see it is significantly reduced. And we have a paper on that as well. It's not the world's first paper. Autism was our first paper. Here somebody had published before us, and 15 other papers. And here is this video of this child from Kenya, spastic quadriplegia. This guy was totally wheelchair bound. He could not use his hands. He could not stand. Before, and you can see after the treatment, after stem cells, he's able to use his hands. He's able to wear clothes. He's able to pack a bag. Earlier he could not use his hands at all. Earlier he could not even stand. Now, not only is he standing, you could take out a water bottle and you could actually open a bottle of water. From being totally wheelchair bound, this child is now walking without any help. So this is the improvement possible in cerebral palsy. Intellectual disability, in which was earlier referred to as mental retardation, now we don't use that word, we call it intellectual disability. Here the damage is a little milder, it's more extensive, and these are our results: 20% significant, 25% moderate, 39% mild, and 13% show no improvement. So 84% success rate. And their memory improves, their problem solving, toilet training, social, all of this improves. And the world's first international paper on stem cell therapy and intellectual disability written by us. And here you can see a scan above, you can see the damage blue, and below you can see after stem cells, the damage is gone. And we've published 5 papers on this. And just quickly run through now: muscular dystrophy. Here's a child with intellectual disability, and you can see the improvements that she had, in her daily activities. Then you can see in her daily activities. And you can see on the left side difficulty in copying. On the right side, you can see how fast she's writing and copying. The coordination is better. And now she's performing the sitar.
Very nice.
Smells
good, looks good, and with stool, perfect combination.
Actually won a prize in cooking. So these are the kind of improvements that even people with intellectual disability have. And the last part is muscular dystrophy. Here the muscles become weaker, and you can see at 5 years, this is what normal muscle MRI looks like, gray, and slowly you can see it's becoming white. By 16 years, there is no normal muscle left at all. So you can see the difference between 5 years and 21 years, from absolutely no muscles. That in one type of muscular dystrophy, Duchenne muscular dystrophy, all these kids, they die in their early 20s, every single one of them. But here are our results, and you can see that 4% have a significant improvement, 35 moderate, 20 mild, 14% remain stable. But what you have to understand is that if we don't give stem cells, all of these kids would have died. All of them would have died. So this is a comparative study where the patients we gave stem cells, they stabilized. The ones who did not, we compared patients who did not take stem cells, who deteriorated like this, to patients who took stem cells, who stabilized like this. So that's the difference. And here you can see on the MRI about this all white before the treatment, and you can see this will become black, and the muscle has come back. And here is EMG, you can see very weak contractions, and here you can see very large contractions. And we have several papers on this as well. And here's this child from the United States with muscular dystrophy. Before coming to us, he could not even stand, he could barely crawl. And before you could see, he can just about crawl. He could not even stand. And after stem cells, he started standing. First, he started standing because he had not stood in 2 years. And from standing, he started walking, first with heavy support, then with lesser support. You can see walking with just holding the parallel bars. Now it looks little, but you have to understand that it was zero before. And now he's walking indoors. And now you can see he's walking outdoors. Okay. And in fact, his improvement was heard by President Obama, heard about his improvements, and he got to meet with the President of the United States. There he is. He's in the White House. President Obama called him to discuss his improvements because these kids otherwise don't improve. So those are the improvements. So now a question all the parents must be asking is that, I've shown the good results. How safe is the treatment? Are there any complications? So that's the good news. There are no major complications. We've treated now over 11,000 patients and we've had no major adverse events or complications. No patient has deteriorated neurologically. There have been some minor adverse events, like 3% of the patients who have epilepsy already. They may have an increase in epilepsy in the first 3 months. I'll repeat this. Only those patients who have regular epilepsy, there is a possibility that after stem cells in the first 3 months, the epilepsy will increase. Those who don't have epilepsy, there's no risk. 10% of the kids have, for 1 or 2 days, they may have a headache with some nausea or vomiting, but this happens in the first 3-4 days while in the hospital. It never happens at home. So there are some minor adverse events, but these are totally reversible. Now, the last part of my talk, so I spoke about stem cells, I spoke about rehab, and now I'm going to talk about integrative therapies. So these are a combination of therapies that help in improvement of brain function. The most important of this is something called hyperbaric oxygen. See, this is a chamber. This is in our hospital. We have 2 of these. You open the chamber and the mother and child or the father and child can go inside. And, and then you're inside for about an hour and oxygen is given under pressure. And that helps. There you can see a parent with a child and very comfortable. There's a TV screen, cartoon, the child can watch it. So it's very comfortable inside. And what does hyperbaric do? See, at normal pressure, like you and I right now, this is our blood. Our blood has got a liquid. It's got red blood cells. It's got white blood cells. Right now, oxygen is only being carried in our red blood cells, in the hemoglobin of our red blood cells. Our white blood cells don't carry oxygen and there's no oxygen in the liquid of the blood. But when you give oxygen under pressure, the oxygen goes into the liquid of the blood. And now, because it's in the liquid, far more oxygen gets to every bit of the tissue, every nook and corner. It goes into every part of the body, including the brain. So that is where you have a lot of very interesting improvements. The benefits of hyperbaric are many, from stimulating oxygen, metabolism, improving energy levels. There are lots of benefits of hyperbaric oxygen. This is just technically to explain what hyperbaric oxygen does. Then we also have ozone therapy. So oxygen is O2, ozone is O3, and it's a form of activated oxygen. And we have been using it. It has an anti-infective action. It reduces inflammation, swelling, reduces blood clots, has antioxidant properties. And it's an excellent treatment which, when you give it along with hyperbaric and stem cell, has wonderful work. There are different ways of giving it. You can give it through the ears, you can give it through the chamber, you can give it through the rectum, you can give it by breathing. And it improves oxygenation everywhere. So it's a very useful thing. That's the benefit of ozone therapy. A detoxification, stimulating, strengthens the immune system, etc. So these are the benefits of ozone therapy. There is a gut cleansing. So we give ozone through the gut. So, our children have a lot of gut issues. When ozone is given to the gut, it cleanses the gut completely. So we have a gut cleansing process in our hospital as well. It's called colon hydrotherapy. And then there are acupressure. Then there is various deep tissue mobilization. We give intravenous vitamin therapy. These are all the vitamins and supplements that we replace. And so all of this is called integrative therapy. And so this combination, stem cells, rehab, and integrative therapy, makes the difference. This is our institute, the NeuroGen Brain and Spine Institute. It's located in Navi Mumbai. It's a very quiet, very scenic suburb of Mumbai. We've treated, it's an older slide, say 10,000 patients. Now it's 11,000 patients from all the 6 continents of the planet, from 70 different countries. That's our core team. Apart from myself, we have Dr. Nandini and Dr. Prerna, who are the stem cell experts. Dr. Jacob is India's senior most rehabilitation expert and the pioneer in neurorehabilitation. He heads our rehab team. And Dr. Himangi Sane is MD physician from America who is working with us as head of our research. We believe in quality, so we have several accreditations like good laboratory practices, good manufacturing practices. So we have all these accreditations. We are certified by the European Medical Association, EMA, for best medical practice. We have written a whole lot of books. These are the books we have written. We've received several awards like this prestigious Rose of Paracelsus Award from the Scientific Nomination Committee of Oxford, the European Award for Best Practices from the European Society of Quality Research. We named the best stem cell therapy center in India at the National Healthcare Excellence Award 2016, again in 2018. Now, to help you make the decision, you could visit our website, which is NeuroGen BSI, Brain and Spine Institute, neurogenbsi.com. You could email us at contact@neurogenbsi.com, and you normally will get a reply within 30 minutes by a doctor, not by an administrative person. A doctor will reply to you in 30 minutes. You can WhatsApp chat, audio, video call, Zoom, set up a Skype interview with prior appointment. Once you've decided to do the treatment, well, you appoint a specific coordinator who becomes your one point of contact. He will assist you through the entire process till you come to NeuroGen. So, to make life easy for you, once you decide, one person will guide you through the whole process, whether you know how to come here, about transportation, appointment, scheduling, if you're from overseas, how to get a visa, you know, all about the travel arrangements, etc. So this is you arrive on a Sunday, Monday all the evaluations, Tuesday we do stem cell therapy, Wednesday to Saturday is rehabilitation, Saturday is discharge, and now this is a 1-week program. Now we have a 2-week program as well, where integrative therapies are given on the 2nd week. So our conclusion is that adult stem cells are safe and effective. See, I mentioned safe before effective. It's a safe and effective treatment option for autism, cerebral palsy, and for many other pediatric and adult conditions which cause paralysis. I'd like to end. We saw the Prime Minister of India talk about stem cells. The world's 2 biggest democracies are India and America. Now let's hear what the President of America has to say about stem cells.
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate a severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So yeah, so you heard the President of the United States and the Prime Minister of India talk about stem cells. So this is not something small. When the leaders of countries talk about something, it is important. It has a social, public health significance. So with that, I'd like to end my talk. I'm open to any questions you have. I can see there are some questions already. Avinash Kharaj, we are planning a stem cell for Tanmay. Need your guidance for the same. Yes, Avinash, please, you're welcome to communicate with us, with your case manager, your coordinator, and we'll be very happy to guide you for that. Yeah. Alan Almeida Alan Almeida says, any reference to a proper statistical study to support this? Yes, we have. Like I said, we have. I showed you the world's first paper. We have a subsequent paper of that with 230 odd patients, where we have done a complete proper statistical evaluation, and that shows very clearly, based on the standard statistical evaluation, that our results are statistically significant. Because you have to understand, a child who cannot talk before stem cells, who has taken all the rehabilitation, and within a few months of stem cells starts talking. I mean, it's a very visible, a very obvious change. There is nothing that you can deny. A child is not talking, he is talking. Okay. A child is going to a special needs school, he can't study. Now he's going to a normal school and studying. Right. So studying in a normal school and excelling. So, I mean, they're real life examples, but that's why, if you mentioned in my, my talk, I said our data is statistically significant, and our more recent study highlights that very clearly. Yusuf Khan says, what is the minimum age to do it? My son is 30 months old, want to know downside for this. How long does it take to see effects of stem cells? Well, there is no minimum age to do. There's a minimum body weight. The body weight has to be more than 10 kilograms. So there is no minimum age. The earlier you do it, the better it is. So at 30 months, fine, you can go ahead and do it. There is almost no down effect if your child does not have any epilepsy. The only down effect is children who have epilepsy. There is a small 3% possibility that there could be an increase in epilepsy in the first 3 months. Apart from that, there is no downside. How long does it take to see effects? It takes 3 months to see the side effects. 3 months after treatment, you start seeing the side effects. Within 3 to 6 months, you see amazing results. Akhtar Ahmed Faiz says, my son who is 11 years old has periventricular leukomalacia. Will stem cell therapy benefit him? Yes, definitely. We have treated a lot of patients with periventricular leukomalacia. This comes under the broad heading of hypoxic ischemic injury, cerebral palsy, under the broad heading. And yes, it will certainly benefit. So I would strongly recommend that you do the treatment. Lakshmi Patlanki asks, will it cover for ADHD? Yes. See, ADHD is actually just a milder form of autism. So a milder autism, we call it ADHD. It definitely helps in ADHD, and the results are excellent. Almost all our ADHD patients are completely reversed. So ADHD, the results are really very good. Ankit Lavanya says, what happens when autism is caused due to genetic factors? Stem cells will heal, repair the brain, but the genes are the same. So the same mutated genes will again cause brain damage after a few years, and they minimize the improvement. So here's what we want to understand. First, not all autism is caused by genetics. Okay, there's a small subsection where there is a genetic cause, but what you have to understand, so the majority of it, there are many other reasons. So for the majority of autism, this is not relevant. However, for those few where there is a known genetic abnormality, what you have to understand is that we are not correcting the genetic defect. What we are doing is repairing the damage caused by the genetic defect. The genetic defect has done its damage. It's done the damage and it's gone. And what we are doing is we are repairing and fixing the damage. Just if, a child, what you have to understand is there's nothing wrong with the rest of the child. An autism child's skin, eyes, bone, lung, liver, kidney, everything is normal. So the stem cells are normal. Okay. And when we take these stem cells and then we put them to repair the damage, just like if there was a fracture of the child and we took bone from the hip and put it in the fractured area, it would heal. It's not that there would be the mutated genes would manifest. So the important distinction to understand is we are not fixing the genetic defect. What we are doing is we are repairing the damage caused by the genetic defect. And from our experience, over 3,500 children with autism, it works. It works in children irrespective of whether they have a genetic cause or not, because we are repairing the brain damage. Then the next question is Paulami says, was reading about tumor and bone growth as a side effect. Well, this tumor and bone growth, this occurs in people who use embryonic stem cells. We do not use embryonic stem cells. We are using stem cells from the bone marrow. We've done more than 11,000 patients, and we have never, ever in the last 13 years seen tumor, bone growth, and we are following up our patients. Okay, we are following up all the patients we've treated, even those we treated 13 years ago, and we have never seen this happen. Also, the stem cells that we use for the bone marrow, they are used to treat actually blood cancer. So something that is used to treat a tumor cancer cannot cause a cancer. What you're saying is true of embryonic stem cells. We do not use, that's why in the beginning of my talk, I very clearly said we do not use embryonic stem cells. We use stem cells from the child, from the own bone marrow. This never has shown to cause any kind of tumor or any kind of bone growth. My application for FDA for autism not approved by FDA or any other recognized government body. So in our country, we have there is a regulation which has come from the Ministry of Health, and what it says is it makes a distinction between a stem cell procedure and a stem cell product. All right. So what we are doing is a procedure. We are putting a needle into the bone, taking out bone marrow, and putting it back in the child. This is a procedure. Procedures never need approval. Please understand. What needs approval is a product. A drug needs approval. So when a drug is sold, it needs approval. When a vaccine is produced, it needs approval because it's a product. So there is a difference. So the FDA is a Food and Drug Administration. FDA, Food and Drug. It regulates drugs. It gives approval for drugs. And we have a very clear regulation in our country which says that if you are taking from the patient and putting it back into the patient, it is not a drug. And so it is not under the FDA jurisdiction of approval. This comes as a medical practice. So yes, but the umbilical cord cells, they are a stem cell product, and to use them, you need approval. So if you are using umbilical cord cells, you need approval for that. And we had to, for example, we used umbilical cord cells to treat COVID patients. We got approval from the FDA to treat COVID patients with umbilical cord. There we had to go to the FDA and get their approval because we were using a product, right? But a procedure does not require approval so long as it, so we have certain things that we have to take. Our oversight is through what is called an institutional ethics committee, which overlooks, our work. And one has to take informed consent from the patient. So it's very written out very clearly what you have to do when you do a procedure. So it is not, so your question, stem cell for autism. So stem cell product for autism, and we are not doing product, we are doing a procedure. And our FDA very clearly says that it does not require permission. Does sensory integration work for ASD and ADHD? Yes, it does, definitely. So if our child, Hetvi Veera says, does sensory integration work? Sensory integration is wonderful. We believe in it a lot. We've seen some amazing changes with sensory integration. So it works for ASD, it works for ADHD as well. Ankit Lavania says, I saw early one of the videos that you will be opening up a new branch in Bahamas. Is there any update on that? Yes, we are working on it. We believe that should be ready, I believe sometime by middle of this year. Work is already in progress there. We already have government permission. Everything is in place. The center has been set up, but like everything else, a new venture does take its own time. So yes, we're going to be in the Bahamas very soon. And those of you who would want to, not travel so much, that will be an option. Then Lakshmi Batlanki says, my son is getting headache frequently. Will that be cured as well? Stem cell does not work for headaches. I mean, stem cell has no role for headaches. It will help in the behavioral issues. It will help in speech. It will help in attention. It will help in concentration. It is not a treatment for headaches. Paulovi says, thank you so much. What immediate reaction you can see in the child? Well, lots of changes. The first thing is cognition. Their understanding improves. They become, their behavioral issues improve. It's much easier to rehab with them. Speech is the last thing to come. Speech takes a little longer time to come, so it's one of the last things to come. But All the other things, the eye contact improves for the first 3 months, and the child who comes back to us after 6 months, completely different child. Many of them have had some amazing improvements in speech. A lot of them can go from special school to normal schools, so on and so forth. All right, I don't see any more questions. Okay, there are a couple of more. Srinath Goel says, hello doctor, when you inject stem cells to the spine, how do you make sure it's actually going to the affected area of the brain where they have to? Srinath, that's a very interesting question. So, this is something we don't have to worry about. What happens in the body, and this is proven, we've done experiments with this, the damaged areas of the brain, they attract the stem cells towards them. So we don't have to ensure the stem cells go here. The body is, made in such a way that when the stem cells are passing by the normal brain doesn't attract it. But the moment it passes by the damaged brain will pull the stem cells. So the body ensures when we inject into the spinal cord, and we have proven this in animals. In animals we have injected, we've seen all of them get attracted by the damaged areas to the brain. So, but that's an interesting question. What is EEG? How would it help autism? EEG is electroencephalogram, like you have ECG for the heart, you have an EEG for the brain. And if this is abnormal, then there is a possibility that the child having epilepsy later on. So that's why we do it. It doesn't help in autism. It just helps us to know if the child is predisposed to epilepsy. Dinesh Yadav says, as we know, autistic kids suffer from many problems. Following on my questions, adult stem cells will help in metabolic, gut, and other issues as well, or will it only help in neuro issues? No, it helps in gut issues as well. We have seen that almost all the gut issues completely resolved after stem cell therapy. So the gut issue is a lot of improvements happen. Is there any cell count, or is it just random? No, we have a cell count per kidney. There's a very precise mathematical calculation. And we inject a certain predetermined number of cells only. Stem cell will help in epilepsy and abnormal EEG. No, stem cell does not help. I repeat, stem cell does not help in epilepsy. In fact, stem cells can aggravate the epilepsy. So stem cell is not a treatment for epilepsy. What is the reason for taking stem cells from the kids born only? Can't we take it bone marrow from the parents? Well, the thing is that the body is programmed to accept its own cells. So when we inject our own cells, the body accepts it better. When you inject outside cells, the body tends to not accept it better, sometimes tends to reject it. And this you've seen in animal experiments. When you inject your own cells, the acceptance is better, the repair is better. If a child is suffering from epilepsy and seizure after stem cell, will it not destroy the stem cells? So Rakshita asked that if the child is suffering from epilepsy. So yes, firstly, not all children, I want to repeat that. Please understand, not all children have epilepsy after stem cell. First, those children who have never had epilepsy, who have normal EEGs, they never have epilepsy. Number two. Number three, only children who have epilepsy, who are having repeated epilepsy anyway. A child who's having 3 episodes a month, well, it may become 4 a month. That is called increase. And this happens only in 3%. 3%. That means out of 100 children who have epilepsy, 3% may have a transient increase in the first 3 months only. So it's not like a child who's not having epilepsy will start having epilepsy. So we don't have to worry about that. And what we have now done is if the EEG is abnormal, we add an anticonvulsant drug. So we've been able to bring down the incidence of epilepsy to almost close to 0 now. So in any case, the seizure episodes don't necessarily destroy the stem cells because our stem cells go and are repairing some other parts of the brain. Gaurav Sandville asked, my child is going to be 5 years in coming March. Her stem cell grows well within 5 years, and after 5 years, improvement will slow. Yeah, so our paper shows that below 5, the results are excellent. I mean, the kids are close to getting to normal. Between 5 to 10, also they are good. After 10 years, after 10 to 11 years, the results become a little less. So at 5 years, it's a perfect time to do it. You should do it now. Amrita Pradhan says, Myself, Adrenaline's mom, we are planning for third child along with HBOT in March. Adrenaline has been improved in a lot of areas, even in speech and language, except counting. Hope after third, we will continue counting. Yes, thank you so much, Amrita. Thank you for hearing that. Adrenaline has been doing good. I remember, seeing him the last time you were here. He's having some really amazing improvements, including in his speech. So, yeah, the only thing left is counting. That will surely improve as well. Avinish says, how many shots require Tanvi says three. Three is normally the max. Most kids don't require more than 3. Is it recommended for high functioning? Yes. Hina Ashur says it's recommended for high functioning autistic kids. Well, it is. High functioning autistic kids do brilliantly. So, in fact, I strongly recommend it. Dinesh Yadav, we know autistic kids. Okay, we already answered that. I think we've answered all those questions, and I'll just see if there are any others in the question and answer session. Okay, so Ankit Davania says, if there is stem cell treatment, does both autism and ID get better, like the percentage improvement of both, or if both are present, does it reduce the chances of improvement? No. So your question is, if autism and ID are there, does it reduce the chances? Not at all. It actually improves in both the autism and the ID both improve. So Ankit, don't worry. If the child is autism and ID, both will improve. Rakshita says, if the child is suffering, okay, that you answered that Rakshita's question. Then Rakshita says, okay, then Hetri says, does omega-3 capsule supplement bring about improvement? Yes, omega-3 is very helpful. We also recommend omega-3. You should continue doing it. Palak ji said we missed the first part of the webinar. Yes, we will. If you send us your email to log in, we will send you the recording, or you can reach us. You can send us an email, or you can communicate with us, and the whole thing is recorded, and we are happy to share the recording. Palomi says, are there any negative side effects? Well, I told you that there is no major irreversible side effect. The only side effects in children who have epilepsy, I'm repeating, in children who are having epilepsy, children who are having 2 to 3 fits every month, they're having regular epilepsy. Only in those kids, in 3% of those kids, there can be increase in epilepsy in the first 3 months, not after that. Apart from that, there are no negative side effects. The answer is Anvit says, we are very much interested in visiting your Bahamas branch when it opens up. How can we move on the next step? Would it be possible to have an appointment? Yeah, sure. You can communicate with us. We have a facility for doing a video consultation, both myself or Dr. Nandini, and you have to communicate with one of our people. We are happy to set it up. All our consultations are without any cost. So you are welcome to set up an appointment, and we'll be happy to consult with you. There is a certain waiting because we are quite heavily booked, but I think about a week or 15 days, we should get an appointment, and we'll be happy to speak to you. Lakshmi says, my son is 11. Is it too late? Well, it's never late. Well, 11 is, it's sort of borderline, so you should do it as soon as possible. The best results are below 5. The next best results are below 11. And so you know, well, it's like this. We cannot make your son younger now, but we can see that 11 years doesn't become 13 years. So we should not wait. We should do it as soon as possible, because as the child becomes older, the results are still there, but the results are lesser. You get results. Even a 15-year-old child improves. The oldest autism child I've is 38 years old, and even he improved. So there are improvements. But the younger the child, more improvements. Dipesh asked, when is Bahamas Center opening up? Well, it's work in progress. We have got the government's permission. We've got to go ahead. The center is in the process of getting retrofitted, so it take a couple of months. I don't know. Maybe by middle of this year we should be good to go. So Ankit says, thank you, Dr. Sharma. Thank you, Ankit. I think that answers all the questions. So with that, we call it a day, and thank you everybody for attending. You can get the whole video link, and you can watch it again. You can communicate with us. We're always available for you. I just like to thank everybody for being a part of this today. Wish you all a good evening, a good night, and a good rest of the day. Bye-bye.